Hi everyone, I just wanted to first take a moment to thank all of you for coming to attend my session, Healthy Strides in Diabetes Managed for Older Adults. My name is Courtney Wu and I am the dietitian for Villa Gardens Retirement Community. I am primarily stationed in the health center in the skilled nursing portion of this community, but I'm also available to all of you for group counseling or individual counseling, and I am also available for these types of sessions, the educational sessions. So today's session is primarily focused on diabetes management, so let's go over the agenda for today. So I will introduce myself in just a moment, and then we will talk a little bit about our topic for today, which is diabetes. And then we will talk about some of the benefits of changing your lifestyle, which also include dietary management and then management and physical activity. And then we'll have a section at the end where you are able to ask any of the questions that you may have had while this presentation goes on. Okay, so just a little bit about myself. Again, like I mentioned, I am a registered dietitian and I obtained my undergraduate degree, the Bachelor of Science degree in dietetics from Point Loma Nazarene in San Diego. I spent 4 years in San Diego doing an intensive program. All of my classes were science related and nutrition related and required for my dietetics degree. And then once I finished that undergraduate degree, I went on to obtain my clinical hours for my dietetic internship and graduate certificate at San Francisco State University. And I spent a year there and I did rotations in a hospital setting for food service and both clinical. And then I also spent some time doing outpatient counseling for weight management, but also for diabetes education and dietary management as well. And because I have half of a master's degree right now, I decided I should probably just go ahead and finish it. Also because I have a passion for nutrition and I have a really strong passion for learning in the science realm, and I know that science and nutrition are always changing, and there's so many sources for you to look. You could just Google online and find anything related to nutrition, but I really wanted to get to the heart of that so that I could be a strong, credible nutrition expert in that area and be able to appropriately provide you with that information. So a little bit about myself. Again, I work in the skilled nursing portion of this community, but I'm also available to you for individual counseling. And my interests, of course, involve food. I love cooking and baking. My grandparents, or my grandma, actually, when she would babysit my sister and I at a young age, she would always have us in the kitchen either cooking to help prepare dinner or baking a sweet treat for dessert. So I've always had that passion for cooking and preparing food. But then I also enjoy the physical activity part of it. I love being out in nature, either hiking in the Eaton Canyon Mountains or going out to the beach for a bicycle ride or just enjoying the sun. So that's just a little bit about me. So first we will start with our topic on what actually diabetes is. So does anybody know, or can anybody tell me what diabetes exactly is? Okay, so first, before we go into what the disease is, I'll talk a little bit about normal digestion. So once you eat and chew a food, all foods are broken down into what is called glucose, which is essentially sugar. So glucose is the body's preferred form of energy. And so then once you chew and digest the food goes down to your stomach and is broken into little particles called glucose. Once the glucose particles are all made, then pancreas, which is an organ in your body, releases a hormone called insulin. And so that hormone is particularly important in uptaking that glucose, those particles, or telling the body to obtain those particles from the bloodstream and take those into the cells so that the cells can use, your body's cells can use those for energy, whether that be for creating other muscles or just fueling other systems of the body. So in diabetes, how does the person who had diabetes, how does their digestion or their digestive system respond? So food is still digested and broken down into the glucose particles, but when it comes time for the pancreas to release the hormone insulin, the hormone is released, but the body does not necessarily respond to that hormone being released. And so the pancreas releases insulin, but the sugar still remains in the bloodstream. So that means because that sugar is not taken up into the cells, the pancreas continues to produce more insulin, and the body still continues to not respond to that insulin being released, and the sugar continues to run throughout the bloodstream. So you have high blood sugar because the sugar still runs through the blood, and the pancreas becomes exhausted because it keeps releasing insulin, but there's no response. There's no response from the cells to tell the body that I've uptaken enough sugar, and then the pancreas still, doesn't have a cue to stop releasing insulin. So why exactly does this matter to you? Why, let's look at this by the numbers. So for all of you, you are at least of the age 65 or older, and the people with diabetes in your age category have, it's about 25% or 12 million seniors who have diabetes. And now you may think, well, if I had diabetes, if I had blood sugar, I would know, right? Well, actually, 1 in 2 people, or about 50% of people who have diabetes are actually undiagnosed. So diabetes is actually still the 7th leading cause of death in the United States. And in 2015, it has caused 5 million deaths so far. So you can see again that diabetes is the 7th leading cause of death in the United States, and 60 to 70% of people with diabetes don't have or experience nervous system damage because, again, as I mentioned in the previous slides, the blood sugar or the sugar in the blood remains high, and so diabetes is one of the diseases that affects the blood vessels, so it can cause nerve damage. And so again, among adults 20 to 74 years old, and I know that's a wide range, but among these adults, diabetes is one of the top leading causes of blindness. And you may think, how is that possible? Well, again, as I mentioned, diabetes is a disease that affects the vessels, and there are vessels in your eye that actually can help with vision. And so when those vessels are clogged or diseased or injured by the high levels of sugar in the blood, it can cause those vessels to not work as well. So why is change important? Now I know we just talked a little bit about the blood vessels being injured, so that may give you a little motivation for attempting change. But some benefits to change. Complications of diabetes can include cardiovascular disease, blindness, as I mentioned earlier, kidney disease, and nerve disease. And so each of these diseases have some intermingling of relation to blood vessels, and when there's too much sugar in the blood, because sugar shouldn't be running through the blood at a high range at all times. That sugar, again, as we mentioned, is energy for the body, and so when the sugar is uptaken into the cells and stored for later energy, that is good. But when it continues to run high, it can cause heart problems or blindness, as I mentioned, or even kidney disease. And what is common in older adults is nerve disease. So you may have issues with your feet too. Another benefit to change is that controlling the issues with diabetes may help reduce healthcare costs. Diabetes cost at least $673 billion in expenditure of healthcare in 2015, which is essentially 12% of the total spending on healthcare in adults. And so if you take control of that earlier, healthcare spending overall in the United States, but even in just your relation to yourself, may decrease as well if you take control and be proactive in diabetes management. So again, a little bit more about diabetes healthcare costs. Direct medical expenses for diabetes for the United States in 2007 was $116 billion, and then it increased to, well, in the previous slide you saw that it was $673 billion in 2015. Okay, so now we'll talk a little bit about how you would manage diabetes. We've talked a lot about what happens if diabetes becomes uncontrolled, and I'm sure that you've heard a lot about diabetes diets and having special foods, but we'll talk a little bit more about what exactly dietary management for diabetes means. So we'll talk a little bit about dietary basics. So there are 3 macronutrients, which are the main nutrient groups of food. So first we have fats, and then we have proteins, and then we also have carbohydrates, which is the larger umbrella for starches, sugars, and fibers. And now carbohydrates are the ones that I'm sure you have heard people say, don't eat too much carbohydrates, or you should have a no carbohydrate or low carbohydrate diet. And that is almost true, but they are saying that essentially because carbohydrates tend to have a greater effect on the levels of blood sugar in the body than proteins and fats do. So what exactly are carbohydrates? So first we have starches, we also have sugars, and then we have fibers. So before looking at this, does anybody know what the difference amongst these 3 are? Okay, so first we'll talk about what starches are. So starches are a complex carbohydrate, and so they have a high carbohydrate content, but they are also ones that take a little bit more energy to break down, so they aren't converted to sugar as rapidly as sugars may be. Now, sugars are simple carbohydrates, and so for athletes or professional athletes, say you're running a quick race or you're going to do some endurance running at the gym, the simple carbohydrates are quick sources of energy because they're quickly broken down in the body and then converted to energy. And then fiber is again one of the complex carbohydrates, and so they're indigestible parts of plants, and they also take a longer time of digestion. So starches, we have beans and grains, whole grains like brown rice, because that has that rough endosperm and germ around of it. Still, it's not stripped of all of those skins. There's corn and potatoes, sweet potatoes, especially with the skin on. And then we have sugars, which is any of the candies or cookies that we have, like the Royale cookies that are most popular here, or ice cream. And then we have fiber, again, things like corn and apples and beans, those things with the skin, but also things that foods that have higher carbohydrate starch content that take a little bit longer to convert to sugar in the body. Okay, so then there are 5 food groups. We have fruits, vegetables, and within vegetables there are starchy vegetables and non-starchy vegetables. Then we have dairy, which includes milk and yogurt. We have proteins like meats and eggs, and then we have fats, which include oils, butters, even cheese, because of the saturated fat content from the animal products, and then we also have nuts, which are in the fat category. And now these are the 5 food groups that we will focus on for today.